One thing I want to ask you about the progesterone, because I did a great podcast interview with Dr. Michael Platt. And have you
Huh?
heard of him and his
Yes.
progesterone cream? And
Yeah.
so he's, obviously trying to sell something, and he's got some great product, and I haven't tested it yet, but I just, it's there. But he says that progesterone cream is very different than the progesterone you take orally.
Mhm.
And so he says it's converts in the liver into a something else that's not even progesterone. So what are your thoughts on a cream as opposed to an oral?
So, there's sometimes I use both together. The problem with progesterone cream is it doesn't appear to cross the blood-brain barrier as well. And so the metabolites you're talking about that come from the liver, well, those actually, some of those metabolites have some beneficial brain effect. So there appears to be less of a brain neuroprotective effect from, unless he has data to support otherwise, and I don't know if he has some research study that I'm not aware of, but the research does not support that the progesterone creams have as much of a neuroprotective effect, nor do they typically cause quite as much of the sort of nice relaxed state for sleep. So oftentimes, but they have some other benefits. So sometimes I'll use a combination in women where I'll use a little bit of orally, like 100 milligrams orally at night, and then I'll tack on because you do get a little bit different effect based on some of that metabolism. And so sometimes I'll use a combination of both. But and I'm not sure if he has data to talk about that, but I have not seen the data to support the transdermal progesterone's benefit to the brain. And it's one of the things I like about progesterone is some of its neuroprotective effects. So I'm still a fan of at least having some of it on board orally,
Mhm.
but there may be data I'm not aware of.
Interesting. So are you not aware of what he mentioned about it being converting into something else in?
Yeah, I mean, there is some there, right? There's so when you take something orally versus transdermally, you get liver metabolism, right?
Yeah.
And so you can get some byproduct conversion, but some of that is actually good. So into these alpha pregnenolone and metabolites
Yeah.
can actually be beneficial to the brain that you don't get with the transdermal. So yes,
Mm,
it is metabolized differently. And what I'm saying is some of those metabolites may have some benefit to us that you
got it.
don't get with the transdermal. But the
Mm,
transdermal has a more direct, because you don't get the metabolism, has a more direct effect as progesterone. So that's where sometimes I think both are beneficial to people. Like you might get more
excellent.
joint effect from some of the transdermal.